Hello and welcome everyone to Women's Health Tech Wednesdays. I am your temporary host for today. My name is Ansley Bowen. I'm the Community Development Manager at HitLab. I would love to welcome our guest, Shailja, from CEO of Curio. Shailja, if you would like to introduce yourself to our audience, and then we will get started.
Thank you for inviting me. Hello, everyone. My name is Shailja Dixit. I am CEO and founder of Curio Digital Therapeutics, a company focused on women's health through with a digital first approach. Nice to be here.
Awesome. Yeah, and thank you so much for your time today. It's always lovely to speak with you. And to kind of start things off, I wanted to ask what motivated you to pursue a career in women's healthcare and specifically the intersection of technology and healthcare solutions?
So, actually, this came from my own personal story. When I had my first and only child, I suffered a lot with the postpartum anxiety, and I had good medical coverage, a very supportive family, but I think the stigma associated with some of these conditions was so large that I felt very uncomfortable even talking or admitting many parts of the things. I have worked in digital space for quite some time. I have also have masters in informatics, and I think when then it there was time to bring everything together, and I realized that maybe digital is as a platform could be a way that is non-judgmental, and women would express more about their meeting a woman where she is rather than her looking for an answer and a solution. And that's how Curio came into existence.
Yeah, well, that's awesome to hear that kind of not so awesome about your personal experience, but that you're able to take that and kind of create something that's saying, well, this is what I don't feel like I had, and turn it into what you can give to other women. And like you said, meet them where they are and everything like that. So, that's so cool that you took it from more from your personal perspective. Were there any other experiences also from more your professional background that also influenced the founding of Curio, and its overall mission to address women's healthcare needs?
So yes, I have been leading the Beyond the Pill initiatives at Sanofi, Allergan, and many more places. So if you think about a pill as an innovation, which is awesome and needed, but it's only one instance in a 25-hour life of a patient, or a person. What else is needed to keep them motivated to manage their condition? And that's what I've been creating those solutions for diabetes and other areas. And I realize the power of digital and data that can tell a person to be motivated and do things beyond what pill can do for us, right? So definitely my research and my work in the areas of diabetes to create a ecosystem, bring all members of the ecosystem together using leveraging technology as a platform did come very handy when I was thinking about this solution for women's health.
Yeah, and also in that kind of that same token, did your previous career experiences also prepare you for the challenges that occurred within the healthcare industry, especially when kind of creating the company, Curio? Were there any challenges that you feel like you faced that you were kind of already prepared for a little bit?
Absolutely. So I have always led market access. So one thing which I was very prepared for was, and this is something often we miss, that it's great to have an innovation, but you do have to put your hat about who's gonna pay.
Mhm.
How is it going to get reimbursed? How will it integrate in a current workflow of a physician or healthcare worker? Those questions should always be answered fairly early on in the journey. And my work with GE, when I was looking at EMR and implementation of EMR and clinical practice, my role as a market access leader at Sanofi and other pharmaceutical industry
Mhm.
helped me a lot in thinking through my business model and looking at every element of adoption. So, you need to think about those things before you can actually bring a successful solution to market.
Yeah, absolutely. And in terms of like that business model and that business plan, were there any specific moments or insights from your career that kind of sparked like what is a better business model to have for Curio, and how did your background contribute to that development of the company's vision and then also your business plan?
Absolutely. So, it was very clear. You need to understand the ecosystem of the payment, right?
Mhm.
And as I was developing Curio, one thing was very clear that you can have physicians physician adoption is very important, but physicians will are not the one who are going to pay for the
Right.
solution, right?
Mhm.
The payment in our system comes from self-insured employers or insurance industry, so that was very clear. Like, I think you need to think, but it's chicken and egg, like that
Mhm.
will not happen till you have physician adoption, right? So I
Right.
think you need to think through these elements and make sure. Another very important component of Curio, there are a lot of digital platforms. We always made our platform such that it's not a point solution,
Mhm.
because point solution have a very limited role. You need to integrate in the ecosystem. So rather than thinking about a point solution, think about the ecosystem solution. That's what I urge many people to think about, because there are so many conditions, so many answers, which are wonderful, but put yourself in your position, in the shoes of a physician. If they have to deal with all of those point solutions, it's a
Yeah.
pretty daunting task, right? Which our physicians are already have burnout and whatnot. So absolutely, that did make a difference in how we made our product, how
Mhm.
we approached it, how we roll it out, our go to market strategy, and many more things.
Yeah, absolutely. I mean, it's really interesting that any little portion of your career leading up to Curio kind of helped in some way shape it, helped you like drive and kind of see what you wanted to do with the Curio, what you didn't want to do, what you think would be the best way to kind of approach, putting Curio on the market. So, can you also, talk about how you were able to do evidence-based and technology-driven solutions when kind of aligning those goals and objectives for Curios for improving women's health as well?
So, I was actually about to mention about evidence based, and
Mhm.
I'm glad you brought it up. Physician adoption will not happen if you don't have the right evidence, right?
Mhm.
Because rightly so, physician, there are two things which are absolutely important. One, it has to integrate in the workflow. So think
Right.
about integration, integration, integration. Absolutely must, right? The second is, to get to that integration and even a dialogue with a physician, you need to have evidence, right? I mean,
Mhm.
why would a physician adopt anything? They have responsibility towards their patients if there is not solid evidence. So at Curio, we have done many, many clinical trials, publish our trials as well. So even if I believe that the bar for digital should be kept, if not as high as a pill, because there is limited side effect of digital, but it needs to be up there.
Right.
And we need to make, it's our collective responsibility to make sure that when we are bringing any solutions to market, they need to have the right kind of evidence. And the third pillar of importance is having the right HIPAA privacy and security. Very,
Yeah.
very important. So these things are integral to making any solution that's evidence based. So not just clinically validated, have proper clinical trials, run
Mhm.
those trials, show the effectiveness slash efficacy, before you launch your solution.
Yeah, absolutely. And just out of curiosity, how long do you feel like it took you to kind of master all those three different levels that you needed for Curio?
It took us a while. I mean, making digital product, I think just a product is easier. Getting
Mhm.
all of these things aligned, it took us about 2.5, 3 years to get
Well,
first version of the product to market.
yeah. Well, good things always take time, right? That's the saying.
Absolutely.
And could you also elaborate on, the specific challenges that women face during puberty, fertility, childbirth, and menopause that Curio aims to address?
So there are many challenges, and there are challenges in each life stage. But
Mhm.
the area we can't solve all the problems and issues, is actually the emotional and mental health. So every life stage of women, from puberty,
Mhm.
going through the reproductive or assisted reproductive treatment if needed, pregnancy, postpartum, perimenopause, menopause. The one factor that is common and is also not talked about very readily is the emotional regulation. Part
Mhm.
of it is biological, the hormones that are changing in every stage, but also a lot of these things are societal and physiological as well. So we actually combine both these things, and we address the emotional health of women across different life stages.
And out of all of those different life stages, which do you feel like does not have as many solutions? Or what did you feel is the most unaddressed life stage?
I think every life stage has its own challenges, right?
Mhm.
But let's take an example of perimenopause, menopause, right? It is an area that has not been, that does not have a lot of solutions. Many solutions are coming, but we still feel that the self coping and emotional health issues are not addressed, and there are not many technology and tools to do that. Similarly, postpartum depression, I mean, there's a lot of spotlight on how does postpartum depression contribute to mortality and morbidity. In
Mhm.
fact, it's considered one of the five top areas of maternal mortality that are completely avoidable if addressed in time. Unfortunately, when you talk about women of color and socioeconomically, underprivileged population, this is even exponential problem. It's much bigger. The prevalence and incidence is higher as well. So I would say every life stage, but we are passionate about these two, which is
Yeah.
perimenopause, menopause area, as well as pregnancy and postpartum.
Yeah, and could you also please elaborate on what Curio specifically does? Like, what do y'all do to help address each of these different life stages?
Yeah, so let me take an example of our most mature product, which is in pregnancy and postpartum. We believe in an analytics driven approach where we are able to actually predict and stratify women who are at a highest risk very early on, provide them with a digital first solution, because that opens up the capacity of access and a low cost platform to get all of the women some kind of solution that can help them. It's a self help solution, but based on science. And then, if needed, triage them to a therapist. Now we are only what happens with this, that something is available 24/7, so access is taken care of. Also, we have mental health professional shortage, and we are only referring to those patients who absolutely need care, to the therapist and so on.
Right. Yeah. And you had also had mentioned that you were very, very important to use that evidence-based practices to tailor your solutions. Do you have an example of how you've taken some evidence-based and really tailored your solutions for each woman's unique needs?
Say that again. Evidence-based solution for the
Yeah.
entire woman's.
Yeah. Like, can you give us an example of what y'all done at Curio when you've used evidence-based practices to tailor for each woman's unique needs?
Oh, absolutely. So, for each of these life stages,
Mhm.
whenever for example, for postpartum depression, we have done 5 clinical trials. We made sure that in this clinical trials, we have diverse population
Mhm.
enrolled across 20 states in United States. So it's a pretty big study. In fact, we did it in collaboration with HitLab. And the idea was to have evidence for every different type of population cohort, and show the impact of our solution in each of those. We are in process of writing a manuscript and submitting it right now.
That's amazing. Yeah, to really make sure that have a very, very, very diverse, population that, you're doing evidence-based, practices on it is so crucial in order to be able to really like hone in on those, tailoring those solutions for each woman's unique needs. So that's amazing that y'all are taking those steps to really try and be inclusive as possible. And in term also like clinically validated solutions, can you provide some examples as well that Curio has offers to women support like mental and physical well-being also?
So so you're raising a very interesting point. Mental health cannot be separate from physical health, right? I
Mm,
mean, it also has this has been my one of my core of our philosophy, that when we talk about mental health, it's not a separate organ, it's part of the body, right?
mhm.
So when we address mental aspect in every life stage, we do touch about the physical aspect here too. So for
Yeah.
example, when we are talking about a emotional health support program during fertility, it talks about what is needed in assisted reproductive treatment and what women are going through. So you can't detach the physical being from the mental being. They go
Mhm.
hand in hand. And this is why a generalized solution does not work. The
Right.
solution was contextualized and has clinically validated, evidence-based, program for every life stage, which is different. What's going on with the postpartum depression versus perimenopause, menopause, and fertility is very different. And we talk about the physical aspect all through as the backbone of our product.
Right. Absolutely. That's a really interesting point that you bring up because you know it is like it is part of your overall well-being. So it's kind of hard to separate it, and the fact that you at least address the mental and physical well-being as one together at Curio, I think is amazing, especially for women in that postpartum life stage. And also talking like how does Curio leverage the intelligent technology platforms to enhance its healthcare solutions as well?
So we have a AI engine, right?
Mhm.
And we use that AI engine to constantly look at the data, assign cohorts of women who may respond. So we use it in many ways. One is we use it in early identification and stratification, and then resource allocation. We also use AI ML to figure out like what are the any adverse events that are happening in, anything that may not be out of norm. We are able
Mhm.
to pick up with our engine, right? With our natural language processing and so on. Another thing is that we also used AI ML to actually contextualize and, a content for Ansley might be different from Shalja, based on
Mhm.
my preferences and your preferences. So we
Right.
use the science part, 80% is all same, right? Because that's how it should be. The
Mhm.
preferences of the member or the person or the user is where we contextualize and modify our content so that you are more receptive, I'm more receptive, and I am more engaged in the platform itself.
Yeah, absolutely. And kind of on that topic of um, how everyone is different, can you share some success stories or positive outcomes from women who have benefited from Curio's solutions?
So many actually. This in 2023, there were 4 women that we were able to completely uh, triage them
Hmm.
and hopefully push them away from a crisis situation, which is pretty big, right? There were actually 5 cases where which were on a slightly milder side, but women did not have right access. And
Hmm.
within 42 hours, we were able to give them very pointed access to what they needed. A woman had a pregnancy loss and she was in a pretty bad shape. She had a shame of admitting it that because this was her third pregnancy loss, unfortunately. So we were able to actually provide her some grief. She said, I've never seen a module which focuses on grief
Okay.
because everybody talks about the baby and having a baby, but there's nothing for those who lose,
Mhm.
a not so positive outcome of the pregnancy. So we are very proud, even, in the starting of our journey, we have been able to triage and, have an impact in women's life. And that's our
Yeah.
goal.
Yeah, and I mean, I was going to ask you, what really sets Curio apart, but you kind of answered that as well, because, a lot of other like healthcare companies don't really focus on that grief aspect. It's more so about the journey and the positives of having a successful pregnancy. But is there anything else that y'all do you feel like that really sets you apart from other healthcare companies that also focuses on women's health?
So I think there are very few companies who talk about the emotional aspect. We touch
Hmm.
on a very unmet need and untouched area, which is also a taboo. I feel digital is so nicely positioned because, trust me, like, people are so forthcoming with digital because they think that no one is judging them, right?
Right.
So we are unique in that way. We use a lot of AI and algorithm to actually generate the right kind of clinical data for the woman at the
Mhm.
different life stages. So that's another thing which is very unique about Curio.
Yeah. And on top of that, also, how does Curio ensure accessibility in delivering its healthcare solutions as well?
So we are all about access, right? So think about it. For a 30-day wait time to get to a therapist, a woman
Mhm.
is able to get to, a self-driven, clinically validated therapist in a box, if I may say, 24/7 ASAP, right? That's
Mm.
all about, and it's extremely cost effective, even if it's something that is out of pocket.
Right. So it's very, very quick, right? It's all digital through an app. They can go on there and they can get help within 24 hours.
Absolutely.
Wow, that's amazing. And then in terms of any future developments or innovations, do you have anything that Curio is working or has in mind to further advance women's healthcare?
So we are actively working on menopause. We'll have our menopause product release in April May timeframe.
Mhm.
This also has a lot of device and wearable integration. That's something that we are moving ahead as well. We are also actively working on large language models. That's something that we are integrating in our platform as well. So constantly, we call it Curio Labs, and we are constantly innovating and looking at new ways of enhancing our
Yeah.
digital offering.
Yeah. Well, that's great. And I'm excited to learn more about what Curio comes out with in the future. And also, just kind of more on a personal question, how do you balance, your career and also being, a woman in your personal life as well? Do you feel like there's any significant challenges or obstacles that have shaped your approach to how you have your manage your work-life balance with that?
So, see, first of all, I'll address the second part. I
Hmm.
don't think so. There's like, we should think about work life balance. I talk about like work interwoven into your life. Okay.
Hmm.
These two are integral. So rather than balancing, oh, this is my work and this is my life, I look at both of them combined, as my work and life has to be enjoyable and they
Hmm.
both are interwoven. So that's the beauty of doing something which you thoroughly enjoy,
Yeah.
rather than doing something which you're forced to do. So it's not work life balance. I don't think so. There's anything like work life balance. Think about having work integrated in your life or life integrated in your work. Once you have
Yeah.
that, if I need to go and talk to my, if I need to have my son do something, why not come to my, come, I can take him to my office and he can
Right.
sit next to me at work, right? So, just integrate both the things. Make sure your family knows about the work that you're doing.
Hmm.
I i bring my son to my work very often, and I like it that way. He appreciates what mom does.
Hmm.
He knows when mom is on a phone call why it is. But I also, another very important thing that I live by is quality over quantity. Even if
Hmm.
I'm not able to spend a lot of time with my son, when I do, it's
Right.
device free time. I'm not distracted. He has my full attention, and I tell him that I'm busy right now, but in 1 hour, you'll have my full attention. And
Right.
then I keep my device away, and that's a quality time rather than a quantity time. So I've not been able to give a quantity time to my family, but whatever time it is, it's a quality time. And then another third thing is, Ansel, Saturday is my unplugged day. So
Hmm.
I try not to work, at least minimum for half a day Saturday. So I won't work till, let's say, late evening or dinner time. That's my unplugged time. So
Yeah.
everybody has their own strategies, but these things have worked well for me. And I think that's what I tell. So, and you asked about like women and being an entrepreneur.
Yeah.
Actually, Curio is all about my lived experience, right?
Hmm.
Curio was born when I had the experience I lived through when I had my child. I'm now in menopause stage. So what is coming in perimenopause? I look at myself as a user of Curio, and what would I have looked at?
Right.
What need I had to go through? So it has only helped me.
Yeah. Well, I love everything that you just said in terms of, making sure that you have quality over quantity. I feel like that's a lot. A lot of us often forget about that and just feel like it's more quality, quantity over the quality aspect. So I think that's really important to put that in the forefront. And then, like you said, right, it is kind of all integrated with your personal life and your work-life balance and stuff. And, if you're really doing what you love, there really doesn't have to be that, balance kind of aspect to it. So I love that. And I really love how you Curio is all about those personal touches that you add to it. You kind of really take it from your perspective and what you would want, right? What you wish you had, and that way you can give it to other women in the space. So I think it's amazing all of the work that Curio is doing. And I just wanted to ask you one final question because we're almost at time here. But as a leader in this healthcare industry, how do you stay informed about the latest advancements in both the clinical practices and the technology to ensure that Curio remains at the forefront of innovation?
One is the hit lab summits, so
Mhm.
make sure you all attend that, right? There are really a lot of like people come together, and a lot of information comes together. So
Mhm.
making sure you pick some of these kind of sessions or summits are really, really important.
Mhm.
It's always humbling to see what others are doing. And I think just a lot of reading. I mean, I again carve out some time every week, if not every day, to just keep and talk to Stan on a monthly basis. So I think, you figure out your way of different information and how you bring that. But definitely highly advise everybody to enroll for Hit Lab Summit. It's a lot of good information that you'll get to hear and learn.
Oh. Well, thank you, and we hope to see you as well and Curio at our upcoming summit, Spring Innovator Summit in May. So thank you again so much, Salja, for all of your wonderful insights and telling us about Curio and the great work that you're doing. Again, can't thank you enough for your time, and really appreciate it.
Thank you so much. I think there were a lot of comments or thing, but I'm happy to answer them. If you want to share my email, I'll be happy to answer.
Yeah, her LinkedIn is in the chat, everyone. So if you want to connect with her there, and then we can also make sure that we share her email with you all as well. Thank
Great.
you so much again, Salja. I really
Thank you.
appreciate your time.
Bye bye.